Hello, good afternoon. Yeah, welcome again to our Facebook Live on every Wednesday. Yeah, today's topic will be very interesting for anyone that having a problem where they look tired or look saggy. Yeah. So before we start, for anyone new here, I'm Dr. Jeff from the Bible Clinic. Yeah, thanks for joining our Facebook Live today. Okay. So if you would like to listen to me speaking in Mandarin 讲华语, you can also type in the comment. I can also speak in Mandarin. Yeah, but in general, usually we try to speak in English so that it's actually more suitable for more people. Yeah. All right. So Sen is here. All right. Hi. Nice to see you again. Okay. Today's topic is very interesting because I find that these related issues of treatment in aesthetics having a lot of misunderstanding amongst the populations. So that's why I would like to take this opportunity to share with all of yours, regarding the proper understanding and knowledge. Okay, how to improve our tiredness and sagginess looking on the face. Okay, yeah, because we understand every one of us when we get older or aging, automatically without you sort of like able to control it, your face appearance will look tired and look saggy. Yeah, regardless how well you rest, how well you sort of like rejuvenate, you probably feel slightly better from an inner strength. Yeah, even sometimes you don't feel tired at all, but your looks appears tired, appears saggy, appears old. Okay, so first of all, we look at this angle. Why is it so? Why there are these kind of changes when we get getting older? Yeah, the reason behind is due to any particular explainable, logics, okay, or reasons behind. Yeah. So, ladies and gentlemen, if you are facing the similar issue when you're getting older, you are having a dilemmas where you look tired and you look saggy on the face. All right. Yeah. Let's discuss. If you have any questions, I will explain one by one regarding the reason behind, and you will be able to understand more. And if you think that you say it actually reduce your confidence to appears in the public, or it makes you feel really not good looking, no confidence, okay, in your work, in your relationships, and you don't feel satisfied whenever each morning you're looking at the mirror and you look at yourself getting old and you don't feel good. All right, so you want to do something on it. So yeah, we also can explain what to do to target this problem exactly. Okay, so again, welcome everybody to our Facebook Live again on every Wednesday. My responsibility here is to share more information, knowledge to every one of you so that you get proper understanding, proper knowledge, to help you, to get a proper treatment and to beautify yourself, okay? Not only for your beauty, appearance, and also for your health as well. Today's topic is more for aesthetic and more on external beauty. So this is very important on the face because the face is where it identifies us. Yeah, every one of us has a very special, unique, appearance. Okay, where it give you the characters. Yeah, it shows other people's your characters, your unique. Right. So the face is one of our important properties. So taking care of the face, taking care of the appearance is crucially important, I would say. Yeah. So, but then because of aging, when the aging kicks in, you can't really avoid the impacts or the damage that the age will cause on the face. Yeah, which is where the aging on the face giving you or causing your face appears saggy, appears old, appears tired. All right. So we are coming to the point whenever, okay, there is a facial emotional expression, okay, which is, okay, let me, I will say, any facial emotion that looks negative, okay, is due to aging of these three parts, okay. All right, the first important thing I would like to explain a little bit here is because facial emotion expression, okay, is usually responsible by our three structures on the face, which is first our muscles. You see, our muscle moves. And when we talk, when it shows our expressions, when you smile, when you're angry, things like that. So the facial muscles is responsible for the facial emotion. But remember, the facial emotion or facial expression is the voluntary movement. Means if you really feel so, if you really feel angry, if you really feel tired, probably the emotion will show up on the face, right? But what happens is when we age, without you really feel tired, okay, but your face automatically shows the emotions, expressions of tired. The reason is because there are some changes, yeah, there is aging changes on the muscles, on the fat layer on the skin, and also the ligament structure on the face. Yeah, these three structure, the muscles, the fats, the ligaments are a complex, yeah, texture that actually, yeah, well studied in medical. So we understand properly every single details of the muscles, the ligaments, yeah, the fat compartment. Okay, yeah, in aesthetic field we need to study all this to make sure that we fully detailedly understanding all this structure. Yeah, so when we are looking at a person's, yeah, telling us, oh doctor, I look tired. Okay, then we need to have a few steps of thinking in the mind. Yeah, first step is we need to see what causes the person's looks tired. Is it around the face appears tired, or is it around the lower face or around the eye? Yeah. From there on, then we zoom in. Is that due to the skin texture or the contour, the line, the shadows? Yeah, yeah, or even the folding, the bulgings. Yeah, that causes the tiredness. Then only we zoom in further, yeah, whether those folds or contours are due to the facial muscles problems, aging, or the fat, yeah, not in a proportional volume, or the ligament are saggy due to gravity pulls. Yeah. So then we zoom in again, okay, to have a full pictures, yeah, of muscles, fat, and ligament interactions. Yeah, when a person talks, so expressions. So we will have these kind of pictures in our mind when we assess. So this is a kind of combination, integration between arts and also science. All right. So this is the ability of an aesthetic doctors, yeah, to really shows the beauty sense, yeah, and to appreciate what the patients complain, what the person's complain. So when you are complaining or saying that you feel tired or saggy or low, then we need to have these few steps of processing in our mindset to figure out, yeah, what is the underlying problems for you. Okay, but summary to say, if you look at the mirror, you don't feel tired, you don't look saggy, you don't look anything old, yeah, yeah, then there is most likely no problem with your muscles, with your fat and ligament structure issues. Okay, but on the other hand, if you do feel, yeah, your facial expression looks tired, looks old, looks saggy, all right, that is definitely due to your aging on these three parts of the face. Yeah. So again, I repeat, if you do see yourself appears in front of mirror or cameras or videos, yeah, and you do appreciate that your face appears aging, yeah, tired, saggy, okay, regardless what word you use to describe it, as long as you looks negative, okay, means you looks tired, old, saggy, yeah, not energy, things like that, means the aging on the face is from these three parts of the body, which these three parts of the face, which is the muscles, the fat, and also the ligaments aging. Okay. Here I would like to clarify because there are many misunderstanding where a lot of people regards aging is on the face, means on the skin. So because if you think that aging when you look tired is because of a skin problem, if you look aging saggy because of a skin problem, then probably you will not able to understand, okay, why the muscles, the fats, the ligaments causing the aging. If you don't understand this, then you will probably look for treatment that actually target on the skin and not targeting on the muscles or the fats or ligament. So in this hand, probably you are not hitting to the point and you are not gaining results, you are not improving, you are not really do a proper sort of treatment to maintain your beauty and to sort of like reduce your aging. All right. So this is the reason. Okay. Yeah. So again, a lot of customer may ask, oh, will facial, skincare, or eating collagen supplement helpful to maintain our aging or not? Okay, the answer is facial, skincare, collagens do helps on a certain percentage of the skin on the surface. Yeah, but it does not help the aging on the muscles and the fat and the ligament structure underneath your face. Okay, again I repeat, facial, yeah, if you do treatment, whatever technologies of treatment, you do ampule, you do machines, you do cool, you do hot, you do electric, you do magnetic, whatever, it helps, okay, for the skin layer to become better, more hydrated, to prevent the aging. Okay, skincare, you apply morning, sunblock, moisturizer, serum, toner. Yeah, at night also you apply mask, night cream, things like that. Yeah, it helps in certain percentage, not all, certain percentage of the skin texture and skin tone, but it does not completely help the aging of the skin, and it definitely do not help at all for the muscles, for the fat, for the ligament structure underneath your face. Okay, yeah. Collagen supplement, yeah, will collagen supplement reduce the aging on our face? Yeah, will our skin, yeah, remain toy, yeah, firm, and also the fat will remain volumized over time? Yes or no? The answer, collagen supplement, no. Answer is no. Yeah. If yes, I think there are many people who are like 50 years old, looks like 20 years old, walking around us. There are many people taking collagen, but the thing is, the answer is no. Collagens is not helping to reduce, this aging on the fat tissue, on the muscle tissue, on the ligament tissue, and the skin tissue itself. Okay, it may helps on certain percentage to rejuvenate your skin. It's like when you eat food, dinner, lunch, breakfast every day, it does give you some supplement effect. Yeah. So, but it does not resolve or sort of like prevents you from aging. So you must appreciate this understanding properly. Okay. So it doesn't mean that you should not take collagen, you should not take skincare, you should not do facial. It doesn't mean that you still can take collagen, you still can do facial and apply skincare, but it's for your maintenance in a daily basis. Okay, to maintain and to upkeep the best version of you at that particular time. But what underlying it that furthering aging is your biological. Okay. So this part you couldn't help. Okay. But let's say if you don't do facial, don't apply skincare, you don't take collagen at all, yeah, your external condition probably is even worse. Okay. So it's like you wash your car every day lah. You wash your car every day, your car is shining, looks good. But if you drive every day, your car still will age. Okay. Yeah. So same logic. Okay. If you take collagen, skincare, facial is like you wash your car, you polish your car every day only. But the internal engine still age. The structure, the lossy, the all the screw, wear and tear will still there. Same goes to your face. Yeah, your ligament, your muscles, the fat tissues are wear and tear. Can say so, wear and tear. If you move every day, the folds will become more and more obvious. Okay. So understand? Okay. Yeah. So in this case, since you understand now, yeah, facial emotion problem, yeah, you look tired, you look saggy, due to these three factors, which is your facial, muscle, ligament, and fat tissue. Then what will be the best treatment to target onto these parts of the problem? Okay, of course, the answer, yeah, is fillers. Okay, fillers. Yeah, filler is to replace the volume onto the fat tissue and also to re-coordinate the muscles interaction with the fat tissue in layer. So it gives the facial emotions or expression which is younger looking. Okay, if you lost the volume of the fat, the interaction between the fat tissue and ligaments become aging. Yeah, so in that sense, you will look old, you will look saggy, you will have folds, wrinkles lah. So that's the reason behind. Okay, But a lot of people say, oh, in this case, it's like, oh, are you trying to sell fillers? That's why you talk all this to let people understand and try to sort of like sell fillers. Actually, for my intention is not to sell fillers, but it's instead when we are aging, okay, this part of the aging is unavoidable. You can't really, you must accept the truth. Yeah, you must accept the truth, which is part of the aging. So when we are dealing with patients with concern of aging, they want to improve or heal it. Of course, we need to find out the real cause underlying the problems. Yeah. So the real cause is proven is aging of the fat and the ligaments and the muscles. So in this sense, how to improve it? The best, I would say, the best solution is filler replacement. Okay, yeah. So this is a true. Of course, if you do not like filler, then you do not force yourself to do it. But then, if you really have the emotional aging, which is age looking, tired looking, and your structure has already older or aging due to the loss of volume of fats and muscle interaction of fats are already distorted at aging, then probably in this point you can't sort of like you if you can't accept fillers, then you probably have to accept the aging lah, in that sense. Okay, yeah. Because many people may ask me, besides filler, any other options? Okay, there are many other options, but that options do not replace fillers, because that options is improving on the other angle, which, like for example, it improves your skin texture, gives shining, so it gives an illusional effect of improvement on your look. Okay, or it reduce your pores and wrinkles, or sort of like pigmentation, then you looks better, but your facial emotions still carry certain tiredness looking, saggy looking. Yeah, but if that improvement, yeah, without using filler, the other parts of treatment already improves you in the sense where good enough, you don't mind of looking a bit old, yeah, which tally with your age, then it's fine. Okay, so this is a proper understanding that, yeah, a lot of people should get to know, or rather than just force yourself, doing something that you not comfortable to. Okay, so the important part is this understanding. A lot of people even don't dare to understand. They were thought of like, oh, when we understand filler means you will do filler. No, you do not need to do filler. You need to understand filler is the knowledge, because medically has proven, yeah, when a person's age on the face especially, so the ligaments and the fat tissues has already a proven factors of aging, and fillers is the definite sort of like choice of treatment for this problem. So letting yourself having this knowledge will help you to be able to justify better, isn't it? Okay, so don't be afraid of getting to know more. Yeah, all right. So besides fillers, any other options? Of course, Botox to reduce wrinkles. Yeah, and of course, then when I talk about Botox, people ask, "What's the difference between filler and Botox?" Okay, I will explain later. Okay, yeah. Then how about like machines? People marketed Pico Laser lah, Thermash lah, Altera lah, whatever treatment branded. So will that help? Yeah, to improve the tire looking or not? Yeah. So same thing. If it is not fillers, that replacing the lost volume in the fat tissue, the rest of the treatment will only indirectly improve. Like you put a makeup, but underlying problem is just covered in that sense. Okay, so then some people may even ask, will thread lift? Yeah, another trend of treatment called thread lift. Yeah, will help. Same. The reason is because when we age, there are certain fat pockets may disproportionately change. So if your fat here lost, but here remain or even bigger, when you push up, you will see effect. But bear in mind, that is only temporary. It's not like stabilizing the whole structure. It's just temporarily trying to put something up. And you move because of the muscle movement due to the aging of the fat and ligament. You will tend to move more, and the threads does not last then. Okay, yeah. Compared to the thread or the ligations plastic surgeon use for the facelift, is different story to say, because the ligations on the thread is a fixed point, and it pulls a fixed ligaments point on the face, and it pulls up. Okay, that is the proper treatment of facelift. But using a thread lift is just a temporary hooking, and the hooking is sort of like soft hooking. It's not a fixed hooking. It's just a sort of like soft hooking from the thread material to temporarily hose up. Okay, so it gives you some temporary improvement, but it does not accumulatively reduce your aging. So the difference is like this, because fillers, if you do it right, yeah, so the result will be able to give you a cumulative, yeah, reduction of aging speeds. Okay, but when we talk about fillers, I see there are many people who will start having a lot of dilemmas, a lot of confused, and a lot of uh, preoccupied concepts. Yeah, hearing from friends, stories, beautician, beauty salon, then telling even doctors also sometimes they are not really sure about fillers. They may even talk a little bit on negative side of fillers. Okay, some I prepare a few questions. So some of them say filler will cause weird looking. So is it true or false? Okay, the answer is, yeah, first we understand our fascia have a lot of structures of ligaments which are already fixed point. Okay, so this ligament fixed point, as I can see, I try to outline here. This ligament fixed point is almost appears the similar, a little bit of variance in between individual, but almost the same pattern. But the other thing is the volume of the bone, the muscles, the fats may be different among each other. Okay, so if a person have a sagginess and a host sunkening there due to loss of volume and muscle distortion when age, if you don't understand the ligament structure and the fat volume, yeah, so you probably when a person do a filler to replace the volume, it boom, it filled up the holes there. It looks nice, but when a person smile, it's something, yeah, weird looking. The reason is because it is over injected. The compartment itself probably only have certain limited volume that the it has. But if you over inject at that particular point and that stretch too much over the surrounding structure, it gives the facial emotion which appears to be weird, and also it will looks unnatural. So the reason a person's done a filler and looks weird is because he has been over injected. Okay, but if we properly injected at each single necessary areas of the face, it gives no problem at all, and indeed it gives a very good results of improving a person's appearance. Okay, so if you do have coming, I mean, if you did come across people looks weird after fillers, true, is because they done fillers in the techniques where it does not go accordingly to the facial compartments and ligament interaction. It just go accordingly to the surface, looking where there is a hole, then you inject, you fill up the hole, regardless, not even care about their structure or ligaments, and just try to force the holes to fill up. Okay, so in a sense, this is a difference between a beauty sense of using filler, which you will over inject, compared to a proper medical sense of aesthetics, which we study on the facial anatomy structures on each individual. If you look tired, then we need to examine your eye, the ligaments here, and the muscles that you have, the tone of your muscle, the fat tissue that you are having, and which fat tissue is losing out the volume, and the loose out volume of the fat, does it affected your ligament sagginess, and does it affect your muscle movement? All these understanding in analysis are very important into our considerations on to whether you are suitable for fillers, and if you are suitable, whether how to implement the filler at your face. Meaning to say, if you are going to implement a filler, we need to assess what volume that you need over each affected fat compartment on your face, and how to inject. First step here or first step here. Each are very important in these details. All right. So if you don't do this, then you are putting yourself into a risk or a chance where you probably looks weird after that. Okay. So another question is, will filler cause permanent changes on the of unnatural look? Means like looking, a lot of people will say, oh, it looks like our ex prime ministers, kind of wives appearance, things like that. We are very sorry to say that this become a sort of stigmata in our society where because uh, there are people who try to aspirin, try to famous themselves using this sort of like current issue or trend to to cling together with their marketing and publicity, and also and try to link with these public figures. So okay, the proper understanding here is filler filler cause permanent change of unnatural look? Okay, the answer is if a person's use a material of filler is just anything that comes as a solution to fill in, is identified as filler too. But the material inside, okay, if we are using something that can cause long lasting in the face, for example, like silicone, the collagen, we call it bovine collagen, or the paraffin oil that used before, and there are many other material that can last long, which does not blends in with our tissue. Okay, that probably will cause permanent lasting. First, this is probably permanent lasting or long lasting in the face. And on the second thing is, if the injection techniques was wrong, where you over inject at one spot, the filler itself, regardless whether the material, can already cause unnatural look. So if the unnatural look together with long lasting or permanent lasting material, then they will cause permanent changes of an unnatural look. Okay, is it logic for you? So to prevent these things, why we need to do so hard, so difficult to prevent? Because filler is still a necessary things, to target your problems. Okay, so anyone who looks tired, aging, regardless whether they are, due to aging, so they need fillers to treat to the point, to best benefit them. But the thing is, you see, there are many wrongdoing. That's why there are these kind of conditions and misunderstanding. Okay, so if a person's having how to prevent these permanent changes of unnatural look, so we must make sure we don't use any material that permanent lasting. On the first hand, don't use any things that come with silicone, bovine collagens, things like that people promise you last more than 5 years, 8 years, 10 years, or forever. Don't use that. Okay. Second, okay, then if you don't use those, then what is the safest material now? Okay, the safest material is hyaluronic acid. Okay, it's not an acid, it's a kind of gels. Actually, it's a kind of protein, sugars, kind of ingredients that actually can, our skin, our face, our tissue, our bodies has this kind of materials or ingredients by nature. So, but if we are using fillers, actually is a kind of transparent gels that already specifically or scientifically manufactured, where it will integrate into our tissues, become part of it, and it replaces the volume of the fat. Okay, so if you are using hyaluronic acid, then the chances of permanent effect will be less likely. And of course, injecting the fillers accordingly to the analysis of your face will try to fulfill the improvement in a natural way, by also at the same time preventing unnatural weird looking on the face. Okay, so these are the understanding. Okay, some other questions. The day I got this question from my patients, they say, will filler cause toxics to the body? Okay, so by studies, okay, we are recommending only currently Juvederm filler, which is the very famous brand for hyaluronic acid fillers, and it has plenty of studies, more than 20 years to prove the safety, efficacy, and also the usage in the human body, and is definitely safe to the body. All right, so no worries on this. So again, come to this dilemma. Must do fillers to reserve the young look? Okay, so again, I repeat in summary, if you do have a concern where you appears tired, saggy, old looking, when you are looking in the mirror or taking photo, all right, so this appearance of emotional as a negative emotion on the face is definitely due to the aging on your muscles, ligaments, and fat. So you can't deny it. So if you are very concerned about this, of course, the best choice of treatment is fillers. If you do not accept fillers, you can do other options like ultrasound therapy, the radiofrequency therapy, lasers, but that does not improve your emotional expression. That only improves your facial skin texture. That probably it also helps you to look better, but it will not resolve completely. It will not straight to the point. All right. So yeah, depends on you how you think. So if you do really have that kind of emotional tired looking and you really want to get rid of it straight to the point, then let's understand about fillers properly. If you understand the filler wrongly, then you probably do not agree with fillers. If you understand about fillers properly, usually it is very sort of like worthwhile to do it. Okay, yeah, but it's not a must for you to understand fillers. If you really stand aside and do not like to do fillers at all, we respect. But then you should not, or you should sort of like put your angles of expectations to other things. Okay, don't expect this machine treatment like ultrasound therapy or laser therapy can sort of like resolve your saggy looking things like that. And you may think that, oh, filler can't do much, that I must do go for surgery. Actually, in this, filler can do better than surgery nowadays. Okay, yeah. So fillers, okay, will cause dependency. Again, these questions are this concern. If not doing fillers again means if you've done once, then if you're not doing in the future, will your aging become worse than before? I can't imagine from where these statements or these kind of dilemmas come, but most likely it comes from some beautician, which are young girls that they are telling people around, yeah, saying that fillers you don't do, if you do, it looks weird, and then after that, if you dissolve it or you don't dissolve it, it will cause you to age faster. Okay, they are sort of like this kind of self non-proven, no evidence base of sort of like statement coming from a beautician, things like that. Okay, and in terms of medical science and research, it's also already proven fillers itself is able to delay the aging in a significant way. Even though you done once and you never do again, it does not cause your aging to speed up. Indeed, it is proven that it will slow down your aging a lot. Okay, so the problem, I think, most likely why this reality, there are people who are really having this issue. I can't deny that certain people who says that, who really in their own experience having the problem where they done filler long years ago, then afterward they probably age faster, or maybe they saw their friends having this kind of issue. Most likely is because of the similar problems as I mentioned just now. It was a wrongdoing where the fillers was wrongly injected over one particular, for example, one compartment of fats. It overstretched the ligaments, and your ligaments are overstretched, and it actually soften or sort of like less faster than it's supposed to be. So that is probably. But if that happens also, usually fillers hyaluronic acid usually lasts about 1.5 years to 2 years. That should not cause permanent impact. Let's say if you over injected, it stretches your ligament. After 1 year, 2 years, it sort of like disappear, but you sort of like saggy more. But usually it will have the ability to heal or sort of like resolve. So I don't think this is a big issue, but the thing is there are a lot of dilemmas and misunderstanding about fillers when people trying to implicate this kind of understanding to sort of like upsell their other products or things like that. Okay, so today is not the selling. I'm not selling you fillers, but I just want to let more people who are having this kind of concern. Yeah, again, I so any one of you, yeah, today who are just joining us. Today's topic is for anyone that looks tired and saggy. So the reason behind is due to your aging in the fat compartment tissue and also the muscle and ligament tissue. So if you are doing, if you are concerned about this issue and you are doing something or you want to really do something on it, fillers, yes, is definitely the best choice. But not saying there are no other choice. Other choice are optional but indirectly improving, but it's not really directly. So but when if you want to do something that directly straight to the point, then probably fillers is a choice. Then that's why my intention or my responsibility here is to let more people have a proper understanding of fillers. Okay, rather than having a lot of this confused, self-created understanding, yeah, from don't know where. Okay, So fillers will cause dependency again just now. Okay. Then yeah, a lot of people may ask, filler Botox, any difference? People say Botox cannot do, got toxic, then will looks like certain people weird looking, after don't do will become weird, permanently change again. This mindset is always there. Okay, I can't imagine, but it's just always there. Probably you're looking at the camera, the social media, the internet. There are too many sort of like things, but that's reality. So why there is still reality and the doctors are not doing something on it? Okay, it's because the reality was happened years ago due to when they used those permanent lasting material in the fillers first, and the injections of fillers or the treatments of filler was not carried out accordingly to the aging of the face individually, but it's rather more on the sort of like art, but it's in the sense of beauty where you see some holes, you try to inject the holes and you just fill up the hole regardless of ignoring all the structure around it, and that's why it happens. Okay, so fillers and Botox totally different things. Filler definitely is a material. Yeah, it most commonly used is hyaluronic acid, come in a jelly transparent form in a syringe to inject onto the specifically designed column of the fats to recoordinate the balance of your facial structure, ligament structure, the fat structure, the muscle structure, so that improve your emotional expressions in your dynamic movement and also as well as your static movement, static condition, right? So fillers in such a is for this manner and such a material. Botox is different thing. Botox usually come in powder. You need to mix with water. So the powder contains botulinum toxins, and the effect of botulinum toxins on the face is to relax the muscles. There are certain wrinkles like yeah, CrossFit, frown line, that you are moving a lot, then you want to relax those muscles so that it doesn't cause the wrinkles so much, or the folding of frowning so much. Then you do Botox, inject directly, but it does not. Botox does not give volume onto the face. Okay, and Botox only lasts 6 months. In January we recommend Botox about 4 to 6 months. Okay, it lasts about 4 to 6 months. Of course, it lasts 6 months, but when you are reaching about 3 or 4 months, certain percentage, about 30 to 40% already starting to fade off. That's why it's averagely lasts about 4 to 6 months. Okay, so fillers. After fillers, will the fillers shift place or become lumpy? Okay, again, these are very common concern among a lot of people. So fillers, if we are injecting properly into the fat compartment, not over volume, it will be very stable and sort of like stays there. Okay, and also with the important criteria is we must choose fillers that's high cohesivity, means it holds up each other. It won't disperse and become small sort of like liquid or droplets. All the fillers must be able to hold up each other in a kind of in a clump. So usually a certain brand like Jordan fillers, they do have these properties in their fillers. So their fillers do not spread and become lumpy and sort of spread widely. Yeah. So together with the proper technique where we calculate, estimates the volume needed, and we need to analyze which fat compartment are affected that needs to be replaced. Then only you inject, and we inject in the proper recommended techniques. There are techniques like line, there are techniques of droplets. So we need to go accordingly to the each single compartment on the face to make sure that the fillers are properly delivered, and then you will be able to stabilize there to optimize the results and to prevent completely on those lumpiness and filler shifting problems. Okay. Yeah, of course, people will still say, "Oh, so good, nothing's to be so good, like impossible. There must be some side effect potential of the fillers, right?" Okay, same goes to, like, for example, Panadol. If you overdose it, what will happen? Yeah, it also can kill a person, right? Yeah, so it's dangerous. So fillers also is actually a material very beneficial for targeting certain problems on the face, especially the emotional aging. But if you're wrongly doing it, yeah, meaning to say over injected, then you cause the lumpiness, the unnatural looks, and also you probably feel pain, swelling, water retention. And if the techniques of injection is not carried out in a proper manner, where it may carry infections, yeah, and also if the fillers are wrongly injected, okay, into the nerves or the blood vessel. It may cause a lot of damage on that as well. So these are the potential side effects. But as a medical professional, we do fully aware about these potential side effects. That's why when we are carrying out the treatment, we are doing a proper techniques to avoid all these side effects. Okay, yeah. That's why there's a difference between medical doctors and beautician, and definitely beautician are not recommended to do injections because why? They do not understand where are the ligaments, where are the fats, where are the nerves, where are the blood vessels on the face. So they probably just putting their needles onto the face where you have the holes, and who knows that area, probably you have a nerves there, you have a blood vessels there, or you have a very important ligaments there, and it may injure it. So who to blame? Okay, yeah. So proper treatment of fillers is definitely to be done by a professional and skilled doctor in fillers injection. And the reason is because we need to optimize the results properly using the fillers to achieve good result or improvement for needed persons, and of course to avoid the fillers side effects as well, okay, for the benefits and safety for the publics. Okay, yeah. All right. So again, questions. A lot of people will say, "Oh, at what age we need fillers? Is it like, oh, when you are getting old lah, never mind lah, 60 years old only we do lah." Okay. Indeed, fillers is needed as soon as when you are early 30s, around 35 years old, because studies have proven that when we are aging about 30 and 35 years old, our facial accumulatively has lost volume roughly about 4 to 6 cc's of fillers. Yeah, 4 to 6 cc's of volume. So you may need about 4 to 6 cc of fillers to replace and to sort of like maintain your young look. Okay. Yeah, of course, when we age, men and female age differently. Certain people age faster. Yeah, actually, female and male age at the similar speed. Yeah, because if as long as they both maintain a similar lifestyle lah. But the thing is, the aging will actually cause masculine or sort of a male look on a female face. So in this sense, females usually see aging faster, but the men wish they age the same, but the thing is they makes them look more men. So that's why they do not really need filler as soon as as early as compared to female. Okay, yeah. But in generally, about 35 years old is the common age where our face are starting to lose volume, where fillers sort of like role is starting. And it can be done at around 35, 40, 50, 45, 50, 55, 60, 65 years old, also possible to benefits from fillers treatment. Okay. So again, men's also need filler. Yes, yeah. Usually, men's when we are reaching about 40, 45, they are coming in where your facials not only men looking but also starting to have tired looking, saggy looking, old looking. Yeah, these are the emotional perspective, and then again, the problem is based from your caused from your muscle and the fat compartment. So you cannot avoid, but if you are very concerned about all this, you cannot avoid. But then fillers treatment is the definite choice lah. Okay. So how long fillers result last and effect last? Okay. The proper understanding is filler is a material, and also through a proper analysis and techniques and also injections deliver the results. So the effect of the filler material itself usually lasts, according to different materials, is averagely about 9 months to 2 years. Okay, I'm talking about hyaluronic acid. 9 months soft fillers, medium fillers about 1 year to 1.5 year. Bit strong filler is about 1.5 year to 2 years. So the fillers with hyaluronic acid usually last about this range. But if we deliver the filler in a proper techniques and optimum calculation and estimation and analysis, and the result done is very nice, and the result can last even more than 2 years. Okay, yeah. So this is the difference, and overall it's quite satisfying. Yeah, if we do it well. Okay, so we are coming always almost near to the end. So I welcome any one of you if you have any questions, regarding fillers treatment, and if you have anything that you are not sure about that I didn't talk about. Okay, then you can put your questions in the comment. I try to answer. Yeah. So I try to share with your about the common concerns and misunderstanding that people have with fillers, that actually they are really able to benefit from filler, but the thing is this misunderstanding causing them to be sort of like unable to really benefits or even dare to try fillers. So a bit sort of like wasted lah for my, I mean, for my point of view, because she or he probably really concerned about her face, but the thing is uh, if she do filler, probably the best benefit, but the thing is she misunderstand about fillers and she couldn't believe anyone else that trying to explain. So that's a thing it happens. Then she went and tried multiple other treatments, and at the end of the day it doesn't fulfill her sort of like expectation. So it wasted money in one sense, and also it also wasted time for herself. And at the point, come to an end point where she lost confidence on those treatment altogether. So who benefits and who become the victim? Okay, so and sometimes also quite funny that girls or probably their patients who are more likely to listen to some beautician or sort of like believes in some beauticians explanations, and then they were sort of like thinking fillers are really bad, then they don't like to, or they don't even dare to try, and they would rather spend some money onto the machines or the treatment or facials packages that they are selling, and try to do something on it, and they just think that that's the best. Okay, and they are doing the best already for themselves, but indeed the best is not there. Okay, so I do find that a lot of this misunderstanding lah, yeah, they're actually coming from different angles through social medias that you probably come across by yourself also in any single days of, I mean, on your of every single second of your life. So you when you first come to contact, you probably will contact with this, and this will create misunderstanding and again. So it's a kind of unhealthy and not proper understanding. So it's actually has its advantage also to be aware of all this, but the thing is that actually also all this improper understanding gives you a sort of a drawback into properly understanding certain things that you actually can benefit from. Yeah, so this is an angle that I do see it is happening in the society. Okay, so we would like to take this opportunity to thank you again to every one of you who lovely spending your time together with us in our Facebook Live. Thanks for listening and answering the, I mean, sending your questions. Yeah, if you do like to know more about our works and also our analysis method of fillers and also aging in aesthetics, don't feel shy to call us. You can call us through WhatsApp by this phone number 017-781-5237. So you can also email us through revivalDoctor@gmail.com. So we are now located in Kota Kemuning. I'm from Revival Clinic. I'm Dr. Jeff. So welcome you to visit our clinics if you would like to have an in-person consultation. And I thank you again. Thank you very much for all your precious time spending with us to listen to our information and knowledge sharing. Okay, I hope that it benefits you. And if you think that these topics also helping for a lot of friends around you, I appreciate that you can share and tag to your friends so that they have the opportunity to listen to this talk and probably can help them to fully understand regarding their concerns as well. All right. So again, I thank you again for everyone who joined us, and I will end my live show here, and I will see you again on every Wednesday. All right. See you again 1 to 2 p.m. Wednesday. All right. Thank you very much, and goodbye.